Good evening. 55 babies who died in Sussex may have survived if they had received better care from the NHS. That's the conclusion of internal investigations into more than 200 cases at the University Hospital's Sussex Trust.
The findings covered cases between 2019 and 2023 at the trust that runs maternity units in Brighton, Worthing and Haywards Heath. They were obtained by a campaign group set up by affected families.
To Brighton now and Kit Bradshaw, where some of the families have been meeting. Kit, what has been said there today?
Well, Sangeeta, it's down to the tireless campaigning of bereaved parents that we've had today's revelations. That figure that you mentioned, 55 babies who may have survived if their care had been different, that's the conclusion of internal reviews by University Hospital Sussex into 227 deaths between 2019 and 2023. We also learnt today that a government-commissioned review into deaths, maternal deaths here in Sussex, has been expanded. Originally it was just looking at 9 cases, now 15 families. One of those 15 families is Katie Fowler and Robert Miller from Hove. Their daughter Abigail died at the Royal Sussex in 2022 after an emergency caesarean section. An inquest found Abigail's life would have been prolonged if Katie had been admitted to hospital sooner. The couple are now part of the Truth for Our Babies campaign group.
We found each other so easily. To come across a group of 9 families, as it was to start with, relatively easily, relatively quickly, all babies born between 2021 and 2023, definitely suggests a problem at that trust. We've obviously since had other families come forward, so sadly, it wasn't a surprise to us.
Kit, University Hospital Sussex is the focus of 2 separate maternity investigations. What stage are they at?
Well, that Sussex-specific investigation that's been expanded that I mentioned, that was ordered by the government last summer, but still hasn't got a chair. The Department of Health told me today that they are actively working with families in Sussex to appoint a chair and agree terms of reference for what they call a vital review. One review that does have a chair is the National Maternity Investigation. That's Baroness Amos, who was actually in Brighton today to meet some of the affected families. But it means this trust and its maternity services is the focus of 2 separate investigations. Now, we've been speaking to Robin Davis. Her son Orlando died at Worthing Hospital 2 weeks after a caesarean section birth in 2021. We asked her what she thinks needs to change.
There are so many factors within it that need to be corrected. It's not just one, it's not just bad staffing. It's this behaviour and this inability to actually abide to the duty of candour and just put your hands up and just say when something went wrong and this is where it went wrong and we are so sorry and this is how we're going to learn from it. But that hasn't really been our experience.
And Kit, what reaction has there been from University Hospital Sussex?
Well, Sangeeta, the Trust points out that over the past 3 years, its perinatal mortality rate has been well below the national average. They also say they've recruited 40 new midwives and made improvements to their telephone triage service. And in a statement, Dr. Andy Heaps says directly to families, he says, "I want to say directly, we did not always get things right. As Chief Executive, I take responsibility for that," he says, "and I am deeply sorry for the pain and distress you experienced while under our care." His statement continues, "Our purpose is simple, to provide the safest possible maternity care. To do that, we must listen to women and families, learn from moments where care has fallen short and support our staff to make meaningful improvements." We've also got reaction today from 2 Sussex MPs.
I visited the Princess Royal in December. I visited the maternity unit because of my concerns, and I've met with the heads of midwifery and obstetrics there. The team there are doing everything they can in their power to put things right, but that doesn't detract from what we've learnt today about things that have gone wrong in the past.
It's so important that there is correct holding to account for the errors that occurred. It's really important that the hospital also seeks to continuously improve and continue to listen to these parents who did know something was wrong and often in some of these cases were not listened to.
Now, the families we've spoken to today want action. They're frustrated by the delays to the Sussex Review, and they hope that the revelations today about persistent failings in maternity care, both here in Brighton and in Worthing and Haywards Heath over a number of years, will provide fresh impetus both to the NHS locally and politicians in Westminster to bring about meaningful improvements.
Kit in Brighton, thank you.